Okay, we're just going to talk about appropriate gauges and lengths of the needle when you're selecting your needles for your patient. So I put a table on on the blackboard, and this goes from infant to adult. Let's focus in on adult first. So for the vastus lateralis, let's see if we can see this better. There we go. For the vastus lateralis, the needle length will be between 1 and 3 inches. Usually what you have in the hospital is 1.5. I haven't really seen that many 3 inches. And the volume that you can give in the vastus lateralis is 1 to 5 mLs. Okay? And it could be less. So just I would say up to 5 mLs. For the ventral gluteal, again, 1 to 3 inches, again, 1 to 1.5, depending on how big your patient is. If you have a very thin elderly patient, 1 inch is probably appropriate because there's less muscle. Again, the volume up to 5 mLs. The deltoid, again, 1.5 is what you're normally going to see. The volume here is going to be lower, so it's up to 2 mLs. And then we have dorsal gluteal, which we're not going to address. So on this chart that I gave you, just ignore dorsal gluteal because that's not the way we teach you guys. We teach you our preferred injection site will be ventral gluteal, okay? Deltoid, you may be giving immunizations there. Sometimes maybe like a Toradol injection, something that's that's not viscous. All right, so they go through infants here. That's going to be your preferred site is going to be for infants, vastus lateralis, even up to children, toddlers, okay? Will be vastus lateralis as well. Okay, so the needle length will be 5/8 of an inch, and the volume is going to be 0.5 ml. That's the max you can give. Okay. You can also do ventral gluteal. Again, 5/8 of an inch, 0.5 ml. Okay, child. Same thing, up to an inch. Up to an inch there, and 1 ml. So what happens if you're pulling up an antibiotic for this toddler and it ends up being 2 mLs? So what you would have to do is one nurse would give the injection on one side and then the other nurse would give the injection on the other side, and you would do it simultaneously. The toddler is not going to let you come back and give another injection after one, so you'd want to do them both at the same time. All right, a child that's a little older, the volume can be up to 2 mLs, okay? Needle length, about 1 inch. And then we did adult. So up to a certain age, once they get to toddler's age, so you'll see for infant, deltoid here is not recommended. Toddler, you can go ahead and do deltoid. They'll start switching some of their immunizations to the shoulders. Same with the child. Okay, so that is the length of the needle. This picture here are your gauges. That's how wide the needle is. So an 18 gauge is something that you would not use for an injection. It'll be used more for pulling up medication. So a 22 for an adult, 22 gauge is fine. There's a 21 gauge. You can see there's different lengths, but this is the gauges, how wide those needles are. 21 gauge, 20. Okay, and as you go all the way down to 25 is very fine. So when we're looking at our selections here, let's just take a look. We got the insulin syringe here, and you'll see it's 0.5 ml. Okay, it's 29 gauge, which is even finer than the 25. And it's at 0.5 inch. Just to show you, this is an 18 gauge 1.5. That's what it looks like. Again, not to give an injection with, more for pulling up medication. It just makes it quicker. This is a TB syringe, It's 25 gauge, it's 5/8 of an inch long. So the finer the needle, it's meant more for sub-Q, like at 25, 29 is more for a sub-Q or intradermal. And as you get a little bit wider, so for your IM injections, I would say anywhere between a 22, even you could even do 25, but 25s tend to get a little flimsy. So 22, 23 is probably about appropriate for that. 21, 20s, they're a little bit too wide. So be a nice nurse. I would say 22, 23 would be appropriate. Okay, thank you.